Good morning, everybody. I'm Juliane Zielonka. I'm a digital health entrepreneur, and as you can see, I got in touch with computers quite early. I'm an internet pioneer since 1994, and the question to you this morning is, are we still fixing healthcare silos by patching it up with new businesses that keep the fragmented health, or are we moving to people-centered healthcare? And the way to people-centered healthcare, which is all about collaboration and support groups, is building businesses along the patient's trail. And it's that simple. It's develop the patient trail in the beginning, follow the path of the patient, identify the pain points of the patient, his or her needs, and the pain points of the healthcare system, as well identify the opportunities for digital health. Who is the payer? Who is the buyer? How can I tell that this is the way? In 2010, I got diagnosed with a fertility-threatening disease called uterine fibroids. The name itself is quite weird. It's actually harmless, it's non-cancerous, and it's benign tissues of the uterus womb. And I ended up using Dr. Google, and it took me 3 months to make an informed decision to find a fertility-preserving treatment along with the diagnosis of my doctor. And though my fertility is preserved, the problem is still out there for every third woman. So it could be you, it could be you, it could also be you that might be in danger of losing your fertility. And what I did actually was I went to the doctors and I co-created a health portal for patients that actually quite solved my problem I had in 2010. So I created a portal that informs women who seek advice for treatment options, that offers unbiased information based on scientific facts and connects them to doctors that consult comprehensively. I raised 200,000 euros from investors and built this portal, and by chance I had my first digital health startup, which is a digital health consulting and publishing company. And companies come to me nowadays and ask me for advice, how can we build patient-centered health solutions? But still, a startup itself is always in search of a business model. And Steve Blank is a Silicon Valley serial entrepreneur. And so we use Steve Blank's approach that startups are always in search of business models. And as we learned from yesterday, the business models in health are not really clear in digital health. Who pays for what and why? It's still the big search going on. And we, as a digital health company, are still in search, how can we monetize this health portal? Because the business model is advertising and that's not really scalable. So we thought, how can we monetize this patient portal? What is the patient's need actually? Is it medical second opinion? So we end up being a marketplace for patients and physicians to connect them to get a second opinion. Do I keep my uterus? Yes, no. Or do we go to behavior change programs where we actually do patient education and teach them how to manage their disease? Or do we go into genome sequencing, which is all possible nowadays? And what fascinates me personally is actually we are about to shift to a digital transformation where we can early detect diseases. It's all possible nowadays. We can save time, and this is what still drives me. And so we reached out to the patients again to find out what are actually your pain points. What is it beneath the disease that your body shows you? How can you manage the disease? And we figured out it's not the disease. The disease is part of a much bigger problem. The disease actually is part of the problem of infertility. And infertility actually means it can have hormonal, genetic, or psychological reasons. And what we found out is it could be 30% the woman who has the causes, it could be 30% the man that has the causes, or it's the couple's combination that caused the infertility, which means actually a couple that's trying to conceive in about 1 to 2 years, and the woman is not becoming pregnant. How frustrating is that? 10% still remains unclear. And we thought, wow, that is a problem we would like to solve. That's such a big problem. And because it's such a taboo topic, digital health is actually the driver, because it's like a companion you can use by your side to find out actually what is the cause of infertility. And the market itself is also huge. The World Health Organization says 9% of the population of women of the reproductive age suffer from infertility, and it can be temporary. So the market size is 72 million. We thought, oh my God, that's still big. And there is science again that leads the way out, because science says once you are already diagnosed infertile and you go to a child planning center, you go to an IVF center, and you do relaxation courses to reduce your stress, at the same time, the chances that you become pregnant are twice as high. Come on, that's so amazing, twice as high. That means the health courses, the relaxation courses themselves have an influence on the psyche, on the mental health of the couple. And what makes more sense to digitize these stress relaxation courses? That's the simple key. And Lara Companion is nothing more than transform offline health courses for relaxation into the digital age, whereas you can use an application to track your progress and see if the stress relaxing tools really help you. And later on, there will be a biosensor that monitors your stress and body vitals. But that's the future. We start with a digitization of relaxation courses first to help these women and couples trying to conceive to become pregnant faster. And when you start with data visualization, you actually discover patterns in your behavior that lead you to a new way out of the trap you're in while you're trying to conceive. And it also helps doctors later on, if they have more data, patient-generated, to maybe detect fertility-threatening diseases quite earlier. And this is a chance for the healthcare system actually to reduce costs. It fits in the system. This is what we figured out. The patient benefits from the measurable outcome, pregnancy, and if the patient still is not able to conceive, they can go for adoption, so they have clarity. The providers, they will have more referrals. If you think of IVF centers currently, their business model is intervention, not outcome. The current business model in health is based on interventions and not on the value of the patient, which is the best health outcome. In case of infertility, the best health outcome is overcoming infertility, and the measurable endpoint is pregnancy. And if there are IVF centers that focus on the outcome rates, of course patients will talk to each other and go to the IVF centers that have higher pregnancy rates, and so the referral for the IVF centers increase. The payers actually benefit from cost optimization because the IVF cycles itself can lower, and they have an improvement in patient compliance. Sounds amazing. So it sounds like a win-win-win situation. So we started looking for investors because we want to build this. We looked for money, and yesterday on stage there were a couple of investors, and we started looking for investors in January. We found business angels, and then we kept on searching 8 months for investors. And we had a lot of talks, and because we kept on searching investors, we had no time to develop the product any further. We ended up actually doing a crowd investing campaign on Germany's very first medical crowd investing platform, which was awesome because we raised 100,000 euros. And we didn't get it. We didn't get it! Because the funding sum actually was 210,000, and it's equity-based crowd investing. That means all the investors who believed in us actually got their money back. Why did this happen? Summertime in Germany. Summertime in Germany means everyone is on holiday, and we completely underestimated the summertime. So now we're here, and there is a new chance because of the crowd investing campaign, we got in touch with a new investor who says, hey, I have had this offline treatment courses you would like to digitize 8 years ago, and I believe in you that your product is the right way. And by the end of September, we're going to meet these people and see if we can connect and build a product. So looking at the whole story of the Lara Companion, which is stress relaxation courses, using a smartphone application to track your progress to become pregnant, where the data selection and progress is just the byproduct, it fits actually into the system. But digital health still is such a hard nut to crack. And we figured out, also from Minsung yesterday, if we are a digital health company and we want to build a product, oh my God, let's stay out of the system. go to the consumer first. Why? Because we want to build amazing products and services for the people outside the doctor's office. Because outside the doctor's office, the problem is still there, especially for these women and couples trying to conceive. There is no psychological help unless you go to a counselor, and we can build this psychological tool to support them outside the doctor's office. So my advice to you is, if you want to build a digital health startup, don't look for the payer. That's the weird thing in the system. A payer is someone who has to pay. A buyer is someone who wants the product. So look for the buyer, and not buyer healthcare. The buyer is the one that really wants the product. So we start in the consumer lifestyle and go and pivot the product with our users until we are ready. The funny thing is we already have a health insurer who would love to implement the whole thing by reimbursement in the system. Still, we focus on the customer first. So coming to the end point, I say as a digital health entrepreneur, keep pushing. It's so rewarding being in health. And once we really crack up the silos and build tools that connect each other, we are about to change healthcare. And it all starts with the patient's journey, and it starts with our ability to actually do something. So what is it that we can do today? And I ask you, what is it that you can do today to transform healthcare? In the end, it's so rewarding. You might end up with a co-founder that is like a Wookiee. You might end up and get the princess. So go ahead and change healthcare today. Thank you very much.
Thank you, Juliane.
Thank you.
So let's go to our panel. Any comments or questions?
Yeah, absolutely. One thing that really came up, and I think is worth discussing, we want to hear your opinion. You said one sentence that every speaker has pretty much said since yesterday. Doctors can use this data. Are doctors using this data? You know, we really have a barrier to entry here, and I want to discuss that. And you had some comments about that as well.
Yeah, I was just wondering how you're going to bring it to market. How are the women going to find this application, and how are you going to make the tie to healthcare feasible? Are the data going to pop up in healthcare systems, or is this just another story that I as a patient have to tell to my physician over and over again?
So the market strategy is, of course, using our patient portal, which has 50,000 visits a month to enter the market. We also have 2 IVF centers as partners, and the health insurer as well is a partner that can reimburse the courses. So there are ways to access. The doctors themselves in Germany would work with PDFs in the beginning because we have very, very strong data protection laws. But in the end, maybe Germany is not the market. We know competitors in different countries who come up with dashboards that physicians use to have more IVF cycle data to give a comprehensive diagnosis.
I think I want to stress out a little bit on that as well. What you can see right now is that there are numerous of systems available. And yesterday you saw the same thing happening as well with Miko from MEDOC, I think it was. He was talking about using Apple HealthKit to communicate health results and also to communicate the values that they get from different physicians. The thing that I'm wondering about is that as a diabetic, I see a lot of fragmentation happening in the market right now. And also what you just said is that maybe Germany might not be the market, but when you look at the European market, every market has a problem with the electronic health record system. Even in Sweden, when you look at the Stockholm County Council, they have one system, and in Uppsala they have a different system, which have totally different ways of using it. You can access your online healthcare record system in Uppsala, but you cannot do that in Stockholm, while the technology is still there. So what I'm wondering is that if you're going to build a system where patients are going to communicate their results with their doctor, are you going to use that with the combination of the electronic health record system? And how are you going to tackle that fragmentation that is happening in Sweden, a country with almost 9.5 million people and has almost the identical amount of digital health record systems available?
First part of your answer is we tackle the issue of mental health. That means we address social behavior and want to track the social behavior progress, whereas we do not tackle the electronic health records. This is a part where we stay out, so we add additional data. It is possible with a strong partner. We have IBM as a partner who has some parts in the field with electronic health records. So I think that's the answer for you.
Thank you.
Anything else from the, that was one more there?
No, I think this is just a call out for, I guess we need a champion and we need someone to take this amazing technology. We're so happy that you developed this. This is an amazing tool for women and we need someone to push it through to our doctors and our medical devices. So come on out.
Yeah, I think I have to agree with that because we have so many different systems, and up until now, I have to say your system actually covers most of it in one platform. So cheers to that.
Yeah, good last comment. We need a champion. We need champions doing this.
Yeah.
We need people leading the way. So on that end, though, I end on that note and saying, Juliana, then there's a challenge for you. Zielonka, as in tsunami, you know, go
Keep
on,
pushing.
go be champion and change the world. Thank you very much.
Thank you very much.
Thank you.
See you.